Hi everyone, I'm Dr. Ann Gillies, and if you were with me last time on the first segment of complex traumatic stress, welcome back. If this is your first time tuning in, this is our second in a series that I am doing. I'm providing this to Steward TV on complex traumatic stress. And so the first session was an overview, introduction, description and definitions. And this time now we are going to talk about the symptoms of post-traumatic stress disorder and complex traumatic stress disorder.
So let me now break this down into the symptoms that one can expect if they have been severely traumatized. So let's talk about first emotional reactions that are experienced. So there is definitely increased anxiety. There's often grief, deep grief, denial of the experience. The mind wants to deny, especially in cases of child abuse, where things have been perpetuated perhaps by a family member. There can be extreme denial and an actual shutdown of the memory, blockage of the memory, panic, depression, fear, continual fear of this happening again. Emotional control, a loss of emotional control. There's an inability to control the emotions. It's either calm or all of a sudden just off the charts with anger or irritability, and intense anger that seems irrational to the outside observer. Feelings of being overwhelmed, and then unusual agitation, physical agitation that can come along as a symptom. So remember, we're talking about symptoms of both post-traumatic stress and PTSD. And then these symptoms also transfer into complex traumatic stress disorder. So you will see all of these symptoms that I'm going to talk about evidenced at some level, even with post-traumatic stress, which lasts under 30 days. Now, when I say you're going to see them, not each person exhibits each symptom. We are just made up differently, and so we experience things differently. So the emotional reactions, and then we have bodily symptoms. So including fatigue. The person just wants to sleep all the time. They may also experience nausea, twitching in their body that comes from fear and anxiety, difficulty breathing, chest pain, because this has been such an intense experience. So if this has just happened particularly, but it also can be a re-experiencing symptom. So the difficulty breathing, headaches. Migraines and severe headaches are very much symptoms of traumatic experiences in the past. Now, not always, but those people who had severe trauma often have migraines as a resulting symptom of unresolved trauma. High blood pressure, unusual thirst, so that's particularly after a severe accident. Grinding of teeth, so that's more of a long-term consequence, a symptom that often happens down the road for those who have experienced complex traumatic stress. Dizziness, the profuse sweating or chills, just a variation of symptoms of shock that affect the physical body. You'll see all of them or some of them exhibited. Then you have cognitive impairment. So that's thinking disorders. Often there's great confusion, especially at the time of the accident or after. So for a child who has been sexually abused by a parent perhaps, there is tremendous ongoing confusion. lack of concentration. The child is faced with something so deep, such a deep wound emotionally and psychologically that they just are so confused. How could this happen? What does this mean? How do they explain it? And of course, the younger the child, the more difficult it is for them to understand what's happened. And there's something within them that they know this is wrong, and this is well, painful, and it's horrible, and they can't stop it. So those are some of the things that happen. Then another symptom of trauma is a lack of awareness of surroundings, memory lapses, the hypervigilance that I talked about. That's a core symptom. There's this just, always watching. And, sometimes, and my husband's done this to me many times, he will come up behind me, and my hearing now is really impaired, and I don't hear him, and I have this shock, startle response. He used to come up behind me very quietly just to scare me, which I told him was just not appropriate. But anyways, now I simply sometimes don't hear him, but I still have the same startle response. So hypervigilance, poor problem-solving skills. They just can't seem to reason things out well. Nightmares. That's a continuing effect of being traumatized. Intrusive images for those who have PTSD, post-traumatic stress disorder, or complex traumatic stress disorder. This is one of the severe results. These intrusive images, they can't shut down what they're seeing. On the other hand, for those with complex traumatic stress, often they have learned to shut it down completely. And it's part of the therapy process actually to help them unlock those memories that they have. They have all the emotion, but they have no connection with the actual memory. So part of the process of healing is connecting the memory with emotion. Anyways, I'm talking about symptoms, so I better stay on course. Loss of time, place, or personal connection, personal orientation. So there's kind of this tremendous loss. And so, for instance, one of my clients, well, many of my clients have had this happen to them, where they have been traveling and have lost all sense of time. They don't know where they are. They're sitting in a parking lot, don't know how they got there. And this is different than just a simple dissociative issue where, you've kind of been what we call spaced out and not thinking where you're driving and you're on automatic pilot. But this is actually, they've driven for hours or several hours and don't know where they went, don't know how they got to where they are. And it's this loss of time and place and personal orientation. And then often with survivors of trauma come thoughts of suicide, suicidal ideation, and even the completion of the suicide act as an act of desperation. Then other symptoms are behavioral. So what you might see are changes in speech pattern. All of a sudden, the child may speak differently, but more so for adults who have experienced deep wounding in childhood. In the process of therapeutic intervention, there may be actually changes in their speech pattern. They may actually begin to speak very differently, more like a child would. And they also could have changes in writing patterns along with that. And that's at a more severe traumatic experience level. But there's withdrawal. Symptoms of withdrawal is a behavioral change. Emotional outbursts, which we've talked about under the emotional changes. Suspiciousness. So there's this suspiciousness of people, lack of the ability to trust. Increased or decreased appetite after an event, an inability to rest, so the sleeplessness. that consumes a person. And for adults who've been say soldiers or victims of rape, there's often increased alcohol consumption or drug abuse, antisocial acts that become symptomatic of traumatized individuals, intensified startle reflex, which I've discussed already, and then pacing. Sometimes people will just pace, and you're wondering what they're doing, but it's part of this bodily reaction to trauma. And then there can be a change for adults in sexual functioning. So those are some of the behavioral changes. And then there's also spiritual changes that happen. So a sense of hopelessness or meaninglessness sets in. And for individuals who have, had an experience with God at some level, this is very disquieting. There's a questioning of one's purpose and an anger, deep anger toward God. There's also questioning of one's own existence and God's existence, where someone who had been previously very secure in their faith all of a sudden begins to experience all of this questioning. Their foundations of faith have been challenged as they attempt to thoughtfully understand what has happened to them. Why has this happened to them? And sometimes when it's an adult who all of a sudden has had childhood memories surface, and this happens often for adults of childhood sexual abuse, who in their late 30s, 40s, even into their 50s, begin to have memories surface, and that's not unusual. Memories that were suppressed in childhood because they were so horrific begin in middle adulthood to come to the forefront of their mind, and it's called flashbacks. And so they're left with this dilemma of what is going on. Often I've had clients say to me, am I going crazy? I feel like I'm going crazy. This could not have happened to me. And I want to reassure them, and you, if this has happened to you, that you've had flashbacks in the past, or even continuing, that no, you're not going crazy. It is simply memories from the past that are trying to surface, and that you have shut down very successfully up until this stage and place in your life. And then perhaps something has happened, or you're just at a stage of life where your mind is able to process more. And so things begin to come to the surface. So those are spiritual symptoms. And so you have all of these symptoms that have now begun to show themselves. Now, some of those symptoms are more directly associated with a current active trauma, or some are more associated with long-term traumatization. But let's talk about the physical symptoms then that happen, because it affects our spirit, soul, and body. And so I'm showing here some of the physical symptoms that you could expect if someone is traumatized. So gastrointestinal symptoms. So that's stomach disorders, so peptic ulcers, but all kinds of gastrointestinal. So acid reflux, those kind of things. When there's trauma and great stress, it affects the body. Cardiovascular, so heart palpitations. That doesn't mean that you may not be having a heart attack. So let's try and make sure we understand that some of these are symptoms of trauma and stress, and others are physical symptoms, but they all manifest physically. So it's kind of a dilemma. Sometimes you have to go to the hospital when you're having increased heart palpitations to find out if this is stress-induced, trauma-induced, or if this is an actual heart attack. So you need to be careful. You need to treat the physical. But you also need to identify what is emotional and spiritual, because all of us are connected in that threefold manner. So respiratory issues, asthma is a big issue for those who have been traumatized, and you can imagine it affects, you hold your breath. And for a child, that's kind of, there's these asthmatic effects. Asthma affects those who have been highly traumatized. It's interesting when we think about how the body responds. And then I did talk earlier about tension headaches, migraines as a common symptom of trauma survivors. Muscular issues, so back, neck, shoulders, joint pain. One thing that I've seen quite often in trauma survivors who have not dealt with the trauma during childhood or early adolescence is fibromyalgia develops. Lupus is definitely connected with trauma and trauma survival. So there's all kinds of other muscular things. So it's like, okay, I have this because I was traumatized. Well, that could be true. It doesn't mean or make it any less that it is a physical ailment, but the root comes from trauma, just as other psychological diagnoses come as a result of being traumatized. And then for women, menstrual issues, the inability to produce, infertility, those can also be a physical symptom of trauma. Interesting, isn't it? How the mind, the will, and emotion affect our body. It's very, very strategic. We're all affected differently. We're made up differently, but these are some of the physical symptoms that can happen. Now, I'm going to talk a little bit more on some of the other things. There is a lot of comorbidity. So that means an association of PTSD, post-traumatic stress disorder, or complex traumatic stress disorder, CTSD, that shows with other psychiatric disorders. So and abuse disorders. So you have alcohol abuse. So you can look here at this chart, and I'm just going to look here short and explain this a little bit. So you'll see the colors. Dark green is for men, light green is for women. You have alcohol abuse and up to the percentage of 60%. With this comorbidity with other psychiatric disorders. So we have PTSD, CTSD, and alcohol abuse. We have drug abuse, which is also very high up there. It's over 30%. Major depression. Interesting. Major depression affects over 45%. Now, these statistics are just statistic. From my perspective, I've seen major depression and certainly anxiety disorders in mostly every single one of my clients with complex traumatic stress. It's just a given that they will feel some level of major depression. No, it may never be diagnosed, but they will have experienced some major depression, heightened anxiety, which we talked about. Social phobias are very common with those who have experienced trauma, extreme trauma. Agoraphobia, so all of those kind of phobias that go along with traumatization. So fear of dark places, fear of being in a closet, fear of small places, all of those kind of things, which can be a result of the trauma, the initial trauma. Generalized anxiety, panic disorder. So panic disorder doesn't show up very, very high here on this scale, but from my experience, panic disorders actually are quite high for clients with complex traumatic stress. And then having 3 or more diagnoses. So it's very easy for someone with PTSD or CTSD to actually be diagnosed preliminarily with other kinds of disorders before the therapist or the psychiatrist ever identifies trauma. which I'm the opposite. I look at the trauma, and then I look at what are the associating factors that come along with this traumatization, and often there's a complex intermingling of what we would call disorders of the mind. So those are just some of the comorbidities. Now, I want to talk a little bit about pathways of disorder. So I've been alluding to this as we've gone along because I believe very strongly in one pathway. But I'm going to show you both pathways. So we have equal affinity, and that means you can have multiple risk factors that have one outcome. So in this case, you have all of these different risk factors. So you can have genetics or biological risk factors, injuries, abuse or chaos. So that lead to an emotional dilemma that creates PTSD. Now, those genetic factors, I would call that instead vicarious trauma. But we may talk more about that later. This pathway of disorder is not the one that I maintain. I want to show you what I believe actually to be the true pathway. So it's called multifinality, and it means that one risk factor has multiple outcomes. So of course, for me, the risk factor is traumatization. And severe traumatization, chronic traumatization leads to emotional regulation. Now, see, I would say that even with PTSD, which is what soldiers certainly experience, and those who are in car accidents or have been raped one time or those kind of things, they will experience post-traumatic stress and post-traumatic stress disorder perhaps, and they will have emotional regulation at some level. But I want to suggest that those who have experienced chronic trauma, chronic sexual abuse, chronic physical abuse, chronic neglect in early childhood, this will create an ongoing inability to regulate their emotion. They never learn how to regulate emotion. It's all flat or poof, like this. And that's because they haven't been allowed to have emotion, to show emotion in most cases. They have to shut it all down because it's not accepted. So what does that create? Well, for those with complex traumatic stress disorder, you could expect to see some of these diagnoses. Borderline personality disorder, which is the very, very most difficult one to treat. Depression and anxiety, absolutely. Criminality. So I want to talk about that just for a moment because we see in our federal justice system many, many people who have experienced severe trauma. And out of that trauma and emotional dysregulation, and because of what they have seen and experienced, so perhaps it's a child who has been subjected to chronic abuse in the sense of domestic abuse, seeing their father beat their mother, seeing something happen that within themselves triggers something. And we sometimes are bound to repeat what we've seen and heard unless we can emotionally process all of those things. And so we see that those who have been witnesses in childhood of domestic abuse often perpetuate that same abuse in the future. If violence perpetuates violence unless something is done to change the inside of the individual, something to change the heart. and the mind and the emotions. So all of those things, trauma can create PTSD. So these are just a few of the symptoms that and the disorders that can be created by a trauma survivor, can be created as a result of surviving trauma. So it really is so deep and so deeply ensconced in our society, and yet it's so misunderstood. So that's one of the reasons that I feel so compelled to talk about these things and to teach on these things, because it's really important for us to understand. Doesn't mean that everyone wants help, but for those who do, it is important that we have some kind of understanding. What could we do to help these individuals? And so understanding the symptoms is first step. Now, when I talk about complex traumatic stress disorder, there is no cohesive literature on complex trauma. Where our understanding of complex trauma comes out of, the literature it comes out of, is out of childhood research on childhood sexual abuse. So the DSM, which is called the Diagnostic and Statistical Manual, it's a big, thick book called the Therapist's Bible, and it lists all of the disorders you could ever imagine that a person might have, mental disorders. And they have criteria specifying a trauma history, so PTSD and acute stress disorder, but nothing, there's no diagnoses for complex traumatic stress. Although there certainly is a contingency of academics who have really pushed for this to be included, because it is, in my mind and from my experience, it shows a deeper level of traumatization and is much more difficult to treat if we don't understand it. And so that's one of the things that I think we need to understand very clearly. So while the symptoms of CTSD, complex traumatic stress disorder, include all of those with PTSD, it also includes these, which you won't find in post-traumatic stress. So, a distorted view of self, low self-esteem, and even self-hatred, self-blame for any abuse that's been suffered. The victim blames themselves. They also seem to have high degrees of guilt and shame that just, it almost hangs over them. Impaired identity formation. And what do I mean by that? Identity formation, identity confusion. Well, particularly with children who have been abused, severely abused at young ages, particularly those who are under 5 years old. Their sense of identity, who they are, and the forming of their own identity is somewhat stalled. Some of it might begin to form later in their lives, but there's like this lack of self-identity that happens for that young child. And then there's a severely impaired trust factor. It interferes with all areas of relationships and developing healthy relationships. So PTSD is not just restricted, though, to survivors of childhood sexual abuse, but it has that research has informed our understanding of complex trauma to a great deal. So in the next video, I'm going to illuminate the symptoms that are strategic for understanding complex traumatic stress disorder. So in this video, this lesson, we have been talking about the symptoms of acute post-traumatic stress and then post-traumatic stress, PTSD. In the next lesson, lesson 3, we will go on to understanding the symptoms of complex traumatic stress disorder, and then we're going to talk more about comparing the disorders and then some of the criteria for diagnosis. Now that may seem a little dry, but I think it's really important for us to understand some of those issues as well. So thank you for listening again, and I hope you'll join me for lesson 3 next time.